We have a new patient on the ward. Her name is Mary Cole, 50 years of age. She was admitted February 9, 2022 at 11:30 p.m. Ms. Mary Cole's reason for seeking health care is that she complains of severe abdominal pain, swelling, also bloody diarrhea for the past 4 days. Ms. Mary Cole's vital sign was assessed in A&E. Her blood pressure was 96 over 50, heart rate 113, respiratory rate 29, O2 sats 97, temperature 38.9 degrees Celsius, and her pain level is 9 out of 10 using the numeric pain scale. She states that the pain is in the lower left abdominal area. The pain is sharp, constant, and is aggravated by movement. She claims that she has been taking extra strength Advil, ibuprofen 400 milligrams for the past 4 days, once a day. Ms. Mary Cole vital signs were reassessed once admitted on the ward, showed a decrease in blood pressure, 85 over 47, heart rate 113, respiratory rate 29, temperature 38.9 degrees Celsius, O2 sats 96, and a pain level still at 9. Also to know that Mrs. Mary Cole had lab values done, CT scans, and x-rays. The results have not came in as yet.
Okay, awesome. So again, staff, we just have here just a briefing that her temperature is 102.2, which means she has a fever. Let's record that and let's monitor that. Okay, so her past surgical history, no known past surgical history, and her medical history is that she had ulcerative colitis and she had anemia.
Okay, Mrs. Cole, can you turn over for me, please? Okay, you can take your time, honey. Turn over slow. Slow as you can get it. Okay. On a scale of 1 to 10, how's the pain, Mrs. Cole?
A 9.
It's still a 9, okay. Have you eaten or drank anything in the last few days?
No, haven't eaten or drank anything.
Okay, your skin is warm and touch. Okay. Alright, Mrs. Cole, I'm going to assess your abdominal areas. That's okay with you?
Yes.
Okay, I'm going to pull down your blanket. I'm going to raise up your nightdress. Okay, Mrs. Cole, your stomach is so swollen and it's distended. You have any comfort?
Discomfort.
Okay, you have discomfort, okay. I'm now going to listen for any active bowel movements, okay?
Okay.
Okay. Your bowel sounds are very low. They are hyperactive, okay? So now I'm going to palpate. I'm going to touch your upper and lower abdominal area. I'm going to start in the upper right abdominal area. Any pain there as I touch it?
No.
Okay, I'm going to start in your upper left abdominal. Any pain there?
No.
Okay, what about your lower?
Oh.
Okay, your lower left abdominal hurts.
Yes.
Okay. Any pain in the lower right abdominal area?
No.
Okay, I'm going to put back down your duster. I'm going to cover you with your gown. Okay, have you ever any recent bowel movements, Mrs. Cole?
I had diarrhea. It was bloody.
Wow. Your urine. Have you urinated? Is it still the same or has it changed?
I haven't been able to urine for a couple days.
Okay. Have you eaten and drank anything in the last few days that may have caused the abdominal pain?
No.
Okay. Alright, Mrs. Cole, I'm finished my assessment. I'm going to gather. Good evening, ma'am. I'm student Miss Randy Taylor. Can you say your name for me and date of birth?
Very cool. January 18, 1972.
Excellent. Can I see your ID band, please? Okay, good. It's confirmed. Okay, Miss Mary Cole, I'm here to do my routine assessment on you. Is that okay to have your consent?
Yes.
Okay, I'm going to gather my materials and wash my hands. I'll be right back.
Okay.
Mary's C-reactive protein. is 16 milligrams per liter. That's really elevated. The normal range should be below 3.0 milligrams per liter. Let me just mark this right here for the doctor. Mary's anti-neutrophil cytoplasmatic antibodies are positive. Bring this to the doctor's attention as well. Her hemoglobin is 7.8. It should be around 12.0 to 15.5 grams per deciliter. Let me bring this to the doctor's attention as well. That's really low. Hematocrit at 23%, when I know the normal range should be 35.5 to 44.9%. Mary's platelets are 100,000, which is extremely low. Just mark this off. Her normal platelet range should be around 150 to 450 platelets per microliter of blood, but she only has here 100,000 per microliter of blood. Hey, that also signifies thrombocytopenia. Let's bring that to the doctor's attention. Her potassium level is low, 3.3, when it should be around 3.6 to 5.2 millimoles per liter. White blood cells are extremely elevated as well as it's 13,000 white blood cells per microliter. Wow, when it should be 4,500 to 11,000 white blood cells per microliter. Let's mark this off for the doctor. We have sodium levels. Let's check that out. Her sodium levels are 128. It's a bit low. 128 milliequivalents per liter. pH is normal. Her pH is 7.26. Let's check out her CO2 levels. 31. That's metabolic acidosis. I see what she was saying about her stool. The stool sample showed a trace of blood and white blood cells. Let me highlight that for the doctor.
Please do take note of the following lab values as they are critically important. Hemoglobin level, hematocrit level, CO2 levels, and lactic acid levels. Take note. As the nurse on duty, we would want to pay special attention to the following labs: hemoglobin as well as the hematocrit levels. I'll tell you why. Her labs need to be closely monitored to ensure that there is no electrolyte imbalance or no further decline due to possible perforation of the colon, which would be told by those same hemoglobin and hematocrit levels. Mary's hemoglobin level is at a 7.8, which is low, as the average value is 12.0 to 15.5 grams per deciliter. Taking a look at her lab values, her hematocrit is also low, as it's at 23%. That's alarming. The usual hematocrit range is from 35.5 to 44.9%. Once Mary's results were in from the labs, X-ray, and CT scan, Mary was then diagnosed by the physician with toxic megacolon resulting from a flare-up of ulcerative colitis and sent to the intensive care unit for close observation, treatment, and monitoring. As for medical management, Mary was prescribed 400 milligrams of hydrocortisone IV to decrease inflammation, and her pain was being monitored and managed, and scheduled IV infusion of acetaminophen, 1,000 milligrams, was given to her every 6 hours, along with 1 milligram of morphine sulfate IV push for breakthrough pain. Mary had also received Zosyn IV running at 25 milliliters per hour every 4 hours. Medical treatment was continued in cooperation with the gastroenterologist, interventists, and surgeons to monitor for sepsis and the need for surgical intervention.
Mary's abdominal CT revealed colonic dilation of more than 6 centimeters in the transverse colon. This called for an NG tube to be placed immediately for gastric decompression due to the CT results. Mary's lactic acid was also monitored every 2 hours until the levels fell below 2. Some nursing interventions include weighing the patient daily and noting any decreases in weight in order to maintain an accurate indication of the fluid balance in the body, asking the patient about their health history as it relates to drinking contaminated water, eating food not cooked properly, and eating dietary products such as unpasteurized dairy products. Eating such contaminated food can cause the patient to be predisposed to intestinal infections, as well as teaching them the importance of hand washing before and after every bowel movement and preparing food. When hands are contaminated, the bacteria can spread very easily and it can also spread to others. As well as providing emotional support for the patient. This sometimes can be a very embarrassing moment, so it can help avoid social anxiety and isolation. Observing and recording the bowel frequency. How often does my patient get up to use the bathroom? Characteristics that can include the urgency, the color, odor, what does it smell like, diarrhea, is it loose, is there blood or mucus in the stool, or is there any abdominal pain, as well as the amount and any bowel habits they may have. With increasing the bed rest, it is important to have most objects and items very close to the patient, hence a bedside commode, so the patient does not have to walk to and from to a bathroom, and also providing comfort items around them such as the remote and other devices so that they don't have to move around and get it, as well as for patients who have diarrhea and uncontrollable diarrhea at that. A part of rest is ensuring that my patient has a bedside commode, so it's right here. So if my patient needs to get up and use the restroom, they do not have to walk far and exert the body. Promoting bed rest to my patient, ensuring that things are around my patient for their enjoyment, such as the TV remote for my patient to watch TV. The bedside table has some water, ensuring my patient has lots of water and is comfortable. Additionally, the diet is everything, ensuring the patient stays on a low-fiber diet that is also high in protein as well as being hydrated. These foods include cooked red meats, fish, poultry, carrots, eggs, lettuce, white rice, dairy products such as milk, cottage cheese, and yogurt. Restricting foods that are high in fiber is important to avoid further irritation of the intestinal lining and giving it rest. Alright, this is just a visual of some of the items mentioned in the diet. So carrots, eggs, some poultry, which would be chicken, lettuce, and some white rice. It's always important to encourage the increase of fluid because it helps replace the fluid that was lost through liquidy loose stools. Encouraging them to eat foods rich in potassium because when they experience diarrhea, the body does naturally flush out all of the potassium through the intestinal tract, so it's better to prevent hypokalemia, and also restrict their dietary intake of caffeine, milk, and dairy products because they can irritate the stomach lining and worsen the diarrhea. Good evening, I am student nurse Brayden, here to educate you on your UC diet, your ulcerative colitis diet. Is that okay with you, Ms. Cole? Okay, so for my presentation, I'm just going to go over some information with you, and at the end, you will do a Kahoot presentation of 5 questions, and that'll be all. Okay, so with UC being an inflammatory bowel disease, it causes inflammation to the digestive tract, as we know. So to help further avoid any more irritation, there are certain diets that will be helpful for you. Such diets may entail low fiber, high protein diets, paleo diets, or even gluten-free diets. This diet allows the digestive tract to rest and relax and should only be used temporarily through experiencing flare-ups. This diet makes it easier for the body to digest foods, and it slows down the bowel movements, which can limit diarrhea. With the disease, the intestinal tract can feel a lot of irritation, so it's best to eat soft and easy digestible foods. Such foods can include low-fiber fruits, bananas, cantaloupes, honeydew melon, and cooked fruits, lean protein, fish, lean cuts of pork, white meat, poultry, soy, and eggs, refined grains such as sourdough, potato, or gluten-free bread with white pasta, white rice, and oatmeal. Allergen-specific types of foods, whether the allergy is dairy or of a certain food or in particular that you may be intolerant to. Fully cooked skinless vegetables such as asparagus tips, cucumbers, potatoes, carrots, spinach, lettuce, and squash. Make sure to avoid fruits in the cruciferous category such as broccoli, cauliflower, cabbage, and kale, as they can increase the inflammation. Ensure that all your vegetables are cooked fully and they are able to mash with a fork to avoid potential irritating fibers that have not been broken down as yet. Now, when talking about vegetables such as carrots and spinach, not only are they tasty and nutritious, but they also provide vitamins such as vitamin A and vitamin K. These vitamins would have been flushed out by the body in large amounts due to symptoms like diarrhea. And lastly, it is very important to keep yourself well hydrated. With symptoms such as diarrhea and other ways of losing lots of fluid from the body, replenishing them is a must. So you can have sports drinks with water as well as no pulp fruit juices, but ensure to drink lots and lots of water. All diet plans can be finalized and constructed with the nutritionist who will work along with your allergies and any preferences you may have. So time for our little game. Now, Ms. Cole, I know this might be hard for you because you have such a sweet tooth, but be sure to stick to unsweetened variety foods because the sugar can cause even more inflammation in the body. So foods like unsweetened applesauce, unsweetened jello, and even canned foods as well in consideration. Avoid spicy foods, foods high in fat and fiber, gluten, and gas-causing foods like onions and beans, as well as caffeine, alcohol, and, as I said, sweet. Mrs. Cole, I am very impressed. You got 5 out of 5 on the test questions, so you have learned a lot, and I thank you for your time today.